Hey everyone, today I'll be talking about the cervical lymph nodes in brief. The cervical lymph nodes are divided into 7 levels. The first level includes the submental and the submandibular group of lymph nodes. The second level includes the upper jugular. The third level includes the middle jugular. And the fourth level includes the lower jugular group of lymph nodes. The fifth level includes lymph nodes in the posterior triangle of the neck. The sixth level includes the pre and the paratracheal and the pre and paralaryngeal group of lymph nodes. And the seventh level includes the upper mediastinal group of lymph nodes. The corresponding diagram shows the distribution of these lymph nodes. Talking about the submental group of lymph nodes. The submental group of lymph nodes lie deep to the chin and they drain lymph from the tip of the tongue and the anterior part of the floor of the mouth. Talking about the submandibular group of lymph nodes. The submandibular group of lymph nodes lie beneath the deep cervical fascia on the surface of the submandibular salivary gland. And they drain lymph from the center of the forehead, the nose, along with the frontal, maxillary, and the ethmoidal ear sinuses. They drain lymph also from the inner canthus of the eye, anterior part of the cheek with the underlying gum and teeth, and the upper lip, and from the outer part of the lower lip with the lower gums and teeth, excluding the incisors. Also, it drains lymph from the anterior two-thirds of the tongue and from the floor of the mouth. Talking about the upper jugular group of lymph nodes. The upper jugular group of lymph nodes lie below the posterior belly of the digastric muscle, between the angle of the mandible and anterior border of the sternocleidomastoid muscle, and it drains lymph from the tonsil. The middle jugular group of lymph nodes drain lymph from the thyroid and from the parathyroid glands. Talking about the lower jugular group of lymph nodes, the lower jugular group of lymph nodes lie just above intermediate tendon of the omohyoid muscle, and they drain lymph from the tongue. The lymph nodes present in the posterior triangle of the neck are present around the spinal root of the accessory nerve. Talking about the prelaryngeal group of lymph nodes, the prelaryngeal group of lymph nodes lie deep to the investing fascia on the cricothyroid membrane. The pretracheal group of lymph nodes also lie deep to the investing fascia but in front of the trachea below isthmus of the thyroid gland. The prelaryngeal and the pretracheal group of lymph nodes drain lymph from the larynx, the trachea, and from the isthmus of the thyroid gland. Talking about the paratracheal group of lymph nodes, the paratracheal group of lymph nodes lie on the side of the trachea and the esophagus along the recurrent laryngeal nerve. And they drain lymph from the esophagus, trachea, and the larynx. Apart from the cervical lymph nodes, some other lymph nodes of importance for clinical examination include the following. The first group is the preauricular group of lymph nodes, as you can see in the corresponding diagram. They drain lymph from the parotid gland, the temporal region, the middle ear, and some other structures. The next group is the post-auricular, or say the mastoid group, as you can see in this corresponding diagram. The post-auricular nodes lie on the mastoid process, superficial to the sternocleidomastoid and deep to the auricularis posterior, and they drain a strip of scalp just above and behind the auricle, the upper half of the medial surface and the margin of the auricle, and the posterior wall of the external acoustic meatus. The next group of lymph nodes are the occipital group of lymph nodes, as you can see in the corresponding diagram. The occipital group of lymph nodes lie at the apex of the posterior triangle, superficial to the attachment of the trapezius muscle, and they drain lymph from the occipital region of the scalp. And also we have the supraclavicular group of lymph nodes, as you can see in the corresponding diagram. So this was all about cervical lymph nodes in brief. Here is the overview of what I have discussed. If you think this video was helpful, do like this video, share this video, and subscribe to my channel. Also, you can check out my YouTube short on examination of cervical lymph nodes, the link for which has been mentioned in the description below. Thank you.